Hello, my name's Anita Cameron. I am Director of Minority Outreach for Not Dead Yet, a Rochester, New York based national disability rights group opposed to medical discrimination against disabled people, medical rationing, euthanasia, and doctor assisted suicide. I'm also a psychiatric survivor. I live with chronic depression and anxiety. My first experience with the mental health system was at age 19. I was living in rural western Michigan, in a little apartment that I was quite proud of. I recently moved from Chicago and had been living on my own um, since age 16 when I entered university. So I was born with multiple disabilities, including vision, low vision, and epilepsy. Uh, but I was able to live independently in the community. And while living in Michigan, my seizures became uncontrolled. And I was hospitalized 30 miles from home as my tiny town had no hospital. When my seizures were finally controlled with the new medication, I wanted to go home to my apartment. The hospital stalled, but one day the sheriff came by to pick me up, and I assumed that they were taking me home. But no, they took me 300 miles from home to a psychiatric hospital. I was taken before a judge, and it was explained to me that because I wanted to live on my own, that I was considered a danger to myself because disabled people shouldn't live alone. So I was committed to up to 60 days, but I wound up fighting for 8 months to get out of there. And finally, with the help of my music therapist, I was able to get out and return home to Chicago. That experience was so traumatic that it led to decades of a revolving door experience with psychiatric hospitals. Um, I was depressed and suicidal, and indeed, I had attempted suicide many times. But after years of therapy, I got to the point where I no longer wanted to die. I fought for my mental health and I won. It's been 16 years since my last hospitalization. I'm also a writer, and I use my writing to get my feelings out and to clear my head. Um, if not for writing, I don't know if my recovery would have been fully possible. I've written about mental health issues and the discrimination that we face. I then used my writing to create gig opportunities for myself, and that culminated in my position at Not Dead Yet. I've written persuasively about opposition to public policy of assisted suicide from the perspectives of communities of color who experience disparities in access to health care. I was even cited in the 2019 National Council on Disability report on the dangers of assisted suicide as public policy. One of the reasons that I am vehemently against assisted suicide is that it turns suicide prevention on its head. It makes death an option for medical treatment, which is absolutely terrifying. Now, in some states where assisted suicide is law, assisted suicide proponents are trying to broaden it by advocating that people with mental health issues should be able to request doctor-assisted suicide. This is already law in some countries like the Netherlands, Belgium, and most recently Canada. Though it'll be an 18-month study period before it's implemented. We cannot allow this to happen. Those of us with mental health conditions, we need services and support, not death. As long as disability discrimination exists in healthcare, as long as mental health conditions and the people living with them are continue to be stigmatized and ostracized, death should never be a treatment option under any circumstances. So if you want to learn more about physician-assisted suicide and other forms of disability discrimination in medicine as endangered public policy, you can visit Not Dead Yet site at www.notdeadyet.org, and the Disability Rights Education and Defense Fund, DREDF, at https://DREDF.org/public-policy/assisted suicide.